So for part 6, we're going to talk about strengths and weaknesses, also known as discussion. It really doesn't matter if you use the word discussion or strengths and weaknesses. It's just really whatever you prefer and how you want to think about it. I usually talk about it in terms of strengths and weaknesses because this helps me categorize my thoughts a little bit better. So what do you want to talk about in your discussion, in your strengths and weaknesses? I will note that this should be one of your longer portions of your presentation, and that's because we really want to know, can you exercise your clinical knowledge? Can you exercise your drug knowledge and formulate your own opinions and your own thoughts about how this will affect your practice in the future? And how should it affect my practice in the future? So this discussion portion, this is where you can really shine. This is where you can show what you know. And just because the researchers have a certain opinion, that doesn't mean that you need to have that same opinion. I've read studies where I completely disagree with the authors in their conclusions about what their study showed, and that's okay. Because it's not a one size fits all for opinions. And just like we know that clinical practice is not a one size fits all. So when you're kind of breaking down your discussion, think about a couple of main questions. And I included a lot of these questions in that tips and tricks document, but it's always important to think about, number one, was it an appropriate study population? So things to think about with study population is, was the actual patient demographics, was that appropriate? Did they collect appropriate data about the study population? Was it enough patients to show relevance? If a study was only conducted in 5 people, but the disease state or the drug is super common, is super relevant, is super prevalent in the population, well, then that study is most likely trash. And those are things that you need to think about when talking about strengths and weaknesses. So another thing to think about is, did they express their data in ways that the reader can understand? And did they express their data in an appropriate manner? So for example, one time I read a study and they expressed their data in mode. So we know that mode, that's just the, say we have a line of numbers, it just picks out what number is the most prevalent. So in my opinion, there are very few situations where mode is an appropriate way to express data. And that's because we don't want to know just what was the most common. We want to know what was the average, because the average is going to tell us kind of where the majority of our patients are at. Similarly, I had another study that they only expressed their data in median, and median's really not going to be as effective for us in a long string of data, because that just tells us where's the middle at. And we want to know, well, what was the general outcome of these patients? What was the general amount of patients? Or say for hypertension, what was the general blood pressure of all these patients? Because how they express data is so important for us making conclusions. And it also kind of speaks to where the writers are at and what they think is important. Because if you think something is important, but the writers don't, that's a real mismatch of opinions. And so that's going to guide your discussion. Another thing to think about is the drug, disease state, and way they did the study, is that relevant and reflective of current therapy practices? So say you have, I think I've kind of used examples to explain this before, but say we're looking at a new study drug for hypertension, and say that study drug only moves systolic blood pressure 2 points. Well, is that drug really going to be relevant to clinical practice when we know that we have ACE inhibitors and ARBs and CCBs that are way more effective than that? Probably not. It probably won't, really make a dent in clinical practice. So these are all things that you want to evaluate. And then also, does their study design back up their outcomes? If we're looking at a retrospective trial, then we need to make sure that they collected enough data points, because you can always go back and look at if they collected appropriate data points. Whereas something that's prospective, sometimes it's really hard in the moment for the researchers to guess what is going to be relevant to the study. And then when it's over, it might be too late. So again, when I mentioned before that, it's better to gather too much than too little, that's another instance where it's important that they gathered enough data. As far as weaknesses, I did mention in the document that the drug or the trial being funded by the company that makes the drug is not a big weakness. And the reason is that a lot of these studies, they're not going to get done if they're not funded by the company that makes them. So it's not a very strong argument on your part to say, oh, this is a really bad study because it was funded by the company that makes the drug. So it's obviously, something that you can include, but it's really kind of irrelevant in today's world. And yes, it might introduce a little bit of bias, but again, studies need to be done, and they're only going to be funded by people that will benefit from them in general. So just something to think about. And then another thing that you want to think about when thinking about weaknesses is that, did the researchers conduct the study in a way that could be replicated in real life? For example, say if we're studying a homeless population, if we had those patients come in twice a week, if the researchers had the homeless patients come in twice a week for 6 weeks, that would be extremely unlikely in the real world, in actual clinical practice, because we know that patients who suffer from houselessness, a lot of times they have difficult finding transport. They don't have stability in as far as safety, where they can store their medications, where they can reliably, maybe get to a phone or follow up with researchers, even follow up with the regular clinical practitioner. So does the study design reflect something that could be done in real life, or is it kind of too perfect of a study, I guess? And then when you're doing your discussion, be sure to differentiate if your opinion differs from the authors. So if your opinion doesn't match the authors, you should state what it is that doesn't match and why. It's so important to express why you feel something is the way it is. Similarly, if you explain why you feel a certain way and your preceptors don't agree with you, that's an opportunity for learning, because a lot of times, our analysis might be incorrect. And it's kind of difficult for your own opinion to be incorrect unless there's like a glaringly obvious real world clinical practice pearl that you don't know about yet. But if your opinion differs from your preceptor or from the researchers, if you can explain why, then your preceptors can see that you are critical thinking, that you know how to take this information and make your own opinion about it. And a lot of times that is what your preceptor wants to see out of your journal club. That's the whole point, is to see, can you read a journal article and apply it to the real world? Discussion is kind of an area where most of your preceptors are going to ask you questions. And so if you are not able to discuss the journal club, you probably don't understand it. If you can't critically evaluate it, you probably don't understand it enough, and maybe a little bit more time is needed to read about it. Sometimes the authors of the journal club will do a really nice job in explaining their discussion, and you can use a lot of those elements to support your own discussion. But just make sure that you're differentiating when it's the author's opinion and not your own, because you don't want to take credit for what the authors did and then your preceptors say, oh, but the author said that, so what do you really think? If you agree with the authors, explain why you agree with them, and that's totally fine. But don't be caught trying to take credit for a thought process that is not your own, because you'll most likely be found out, and you're really not getting the point of the journal club.